constant pain, not being able to do anything. I would either be sitting down or laying down all day because of the pain. My legs would give out because of the pain, and I'd fall. I just couldn't do anything. There were 4 different medications I was on, oxycodone being one of them, and I've been on them for over 10 years.
Joanne had what we call flat back syndrome. It is often driven by the lack of spine contour after multiple operations. We are all born with something called lumbar lordosis, and the lordosis allow us to stand up straight. We could lose this contour secondary to arthritis or secondary to a trauma or osteoporosis to a point that is not adequate for us to stand up straight. The challenging part about flat backs is they require highly challenging surgical operations, only done in specialized centers, comfortable taking care of those patients. The most common story for us is a patient that come in after seeing somebody else and they were told there's nothing we can do to help you. It doesn't mean that there's nothing to be done. It often means that the fix is out of their comfort zone. With another, one level fusion or something small.
I've never seen a place like this. They're excellent. They know what they're doing and can explain it to you what they're going to do.
We're fortunate at the Miriam Hospital now. We were designated a Center of Excellence by the Joint Commission, and we have a extremely thorough pre-operative classes and optimization pathway. What I call the journey, all their vital organs, heart, kidney will be tested to make sure everything's working properly. And then we double check their nutritional status, inflammatory markers, vitamin D, calcium. It's a battery of about 15, 16 tests.
Doctor sent me for all kinds of scans, CAT scan, bone scan, and they found out that I had osteoporosis really bad. He said that I needed to address that first before we could think about surgery. And then he said, go to physical therapy for a while, lose weight if you can, and I did.
She attended our classes. The managers explained to the patient what they expect, what they are about to experience. She went through the class and then she underwent the surgery.
I wasn't afraid of the surgery. I knew what I was going in for. If it's not time for it, he had me wait. He kept saying, oh, it's not going to get here fast enough. But it did, and he knew exactly what he was doing.
Okay, all right. Hey. Joanne was a rock star. She embraced her condition and she fought through it. She really wanted to get better. She did everything I asked her to do, and she was expecting with eagerness the treatment. And that's very, very important, because if a patient is apprehensive to a treatment, they shouldn't have the treatment. They should have full belief that this is the right thing to do. They should trust their provider, trust the step they're about to take. And she did that. And she had the surgery done and she did phenomenal. She came at the 3 weeks mark after surgery, a smile on her face.
I feel excellent. There is zero pain. I'm off the oxy now. I'm off all the other medicines that I was on. I just can't believe it.
And that's the best part of the job. That's what I love about it the most. Sitting in the office, waiting for my post-op patients to come, to see how they stand, to see how they feel, to see how they smile. I'm always there excited. They got taller, they're happy, and that will keep me going every day.
I'm just doing so well. I just envision it's just going to get better. We have a motorhome that my husband's going to be retiring next year, and we're going to be traveling the country. I needed to do this. I would tell anybody, don't be afraid of the surgery. Get on it, because you don't want to live like that any longer.